Today's webinar will help you to prepare for the data that will be coming out September 10th and 12th about poverty, income, and health insurance. We have 3 stellar speakers, and we want to make sure that you have ample time to ask questions and engage with our experts, so I will be brief. Just first, a couple housekeeping items and reminders. 1, type your questions in the Q&A box. Questions will be addressed and answered after each speaker. And we'll be reminding you throughout the course of the webinar that the slides, the recording, and other resource materials will be emailed to all registrants of the webinar. And as always, these webinars and so many other CHN resources and activities and events would not be possible without the generous support of our funders, and we greatly appreciate that support. Now to our program. The webinar is divided into 2 parts. We'll start with an analysis of trends, the best speculation as to what the new data may show, and key policy lessons we can draw from that anticipated data. Then Deb will guide us through some messaging tips, encouraging us all to use the data to make the case for restoring the expanded child tax credit, the EITC, for preventing the ACA premium tax credit from expiring, protecting and improving Medicaid, and as the prerogative of the chair, protecting and strengthening SNAP. Part 2 is Deb running through all the practical, technical aspects on how to find the data on the census website, the CPS, the ACS, and my personal favorite, the SPM. Every advocate should have a favorite poverty measurement, and that's mine. Now to our experts. Chris Weimer is co-director of the Center on Poverty and Social Policy at Columbia University School of Social Work. He is also the project director at the Robin Hood Poverty Tracker, which measures poverty in New York City, which we were talking about right before this webinar started. Chris conducts research on the measurement of poverty as well as historical trends in poverty and how impacts of social policies have on the poverty rate. He also focuses on how families cope with poverty and economic insecurity, with a particular focus on how families manage food insecurity and other forms of material hardship. Fun fact about Chris, when he's not poring over charts and stats, he can be seen, as he was last Sunday, at the US Open and other Grand Slam events, which will hopefully take him next spring to the French Open. So I'm going to lob this one over to you, Chris.
Well done. I love the tennis pun. But yeah, thank you. Thank you for having me to talk about the upcoming census numbers on poverty and income, which will be released on Tuesday. For the past few years, the Census Bureau has been releasing all of the poverty numbers from different measures together in one report. It used to be the case that the official poverty measure, those numbers would be in a big report with the income numbers and the health insurance numbers. And then the census would release their supplemental poverty measure, the SPM results, in a separate report. For the past few years, they've sort of put all those numbers together in one poverty report, which has been, I think, really useful and handy. And as that preamble, sort of implies, we do get 2 different poverty numbers from the Census Bureau every year. The official poverty rate numbers, as well as the supplemental poverty rate numbers. The official poverty rate and the official poverty measure has been going back to the 1960s and is sort of the government mandated statistic that has to be released every year. The key thing to know about the official poverty measure and the official poverty rates is that it's based on pre-tax cash income, which has become like an increasingly antiquated and out-of-date concept when it comes to measuring the resources that families have at their disposal. So in particular, it doesn't measure resources that get delivered through the tax system, such as the earning of tax credit, the child tax credit. It also doesn't capture resources that come not in cash, so things like food stamps, school meals, housing subsidies, et cetera. All of those have become increasingly important in the budgets of low-income families in recent decades. And so the official poverty rate and the official poverty measure has become like increasingly outdated and increasingly antiquated. It's antiquated for other reasons that I won't go into at length, but those numbers will come out. I think in recent years, most people have started to kind of almost ignore them, which I would sort of mostly recommend. I think one virtue of the official poverty measure, if there were one, is that it sort of tracks sort of market income a little bit better. Or not better, but it, because it doesn't count all of these resources from taxes and transfers, which is a flaw. It does sort of track things like the unemployment rate and et cetera. But SPM is really what to pay attention to, I think, and what most people pay attention to on Tuesday. And the SPM is an improvement over the official measure in that it is a more comprehensive measure of resources that capture those tax credits, capture the in-kind resources, makes other improvements, like it reflects a poverty line that is more contemporary based on actual patterns of expenditures by families on a core basket of goods like food and housing and clothing and utilities. And it also, it allows the poverty line to vary across the country in places that are more or less expensive. It also, modernizes the conception of the family, allowing for discussions about, treating cohabiting couples similar to married couples, et cetera. So that becomes really a more robust poverty measure than the official measure. And it's been released by the Census Bureau back to 2009. 2021 represented a historic low for child poverty at just 5.2%, mostly driven by the expanded child tax credit that year, as well as other pandemic-related aid. And in 2022, we saw a big increase in poverty and child poverty as that pandemic aid expired. And the poverty rates were pretty similar to pre-pandemic rates in 2019. In 2023, the numbers that'll get released on Tuesday, we largely expect not a huge change. I think that if anything, the poverty rate, my guess would be, will go up a little bit. And that may be because of the poverty line, the poverty thresholds. So we've had a period of rapid inflation, and that inflation, although the poverty lines are based on expenditures, expenditures are in part driven by prices, and the inflation that's occurred and that a lot of families are feeling are driving up those poverty thresholds relative to historic changes year to year in the thresholds. So with those higher poverty lines being driven up by inflation and maybe even outpacing inflation, in some ways that might drive up the SPM poverty rate overall and for specific subgroups. You also have in 2023, no major expansions to the sort of policies and the expiration of all that pandemic aid that occurred in 2022, if anything, is more pronounced in 2023. So we don't really see the government policy supports, even though they do reduce poverty a lot, no major changes in that to counteract the changes in inflation to some degree. One other thing I like to point out with regards to the SPM report that's been difficult in the past few years is usually they will publish state poverty rates in those reports. Those state poverty rates, because the national data set that they use is a smaller data set than the American Community Survey, will usually publish state rates based on 3 years of data. And so they may have those rates for every state based on the past 3 years of data, but it's worth remembering that those 3 years are, in this case, 2021, 22, and 23. And so those are, 22 and 23 will likely be fairly similar years, but 2021 was really a quite different year with this historic amount of pandemic-related aid and these historic low poverty rates and child poverty rates. So any 3-year estimate at the state level is probably going to look lower than it actually really is in present day because it's factoring in that 1 year of these abnormally low poverty rates. The other thing to pay attention to, like I said, is the SPM goes back to 2009 through the census. Our group at Columbia has created a historical series that goes back to 1967. So a lot of times people are interested in what the rate that comes out on Tuesday will look like in the long-term historical perspective. They are both using the census's approach, which allows for the poverty line to evolve over time with living standards, but also with some people prefer a more sort of absolute or anchored poverty line where the poverty line is held constant and is just changed back in time for inflation. In either case, in both cases, the poverty rates that'll come out on Tuesday will be quite low in historical perspective. So, we found back when we first published this series, and we've obviously continued the series since, but poverty has been reduced dramatically in the US over the past 55 years. A caveat to that is that reduction in poverty has mostly been driven by government policies and programs and the resources from those policies and programs, which in some sense is a success of policy. On the other hand, the poverty rate, absent counting resources from those government policies and programs, has never fallen below 20% in the entire 55-year period over which we have estimated that series. So, despite 5.5 decades of economic growth, we really haven't seen the market delivering lower poverty rates over time. The reductions we have seen have come from government policies. So that's poverty. The other the numbers that will come out that I was supposed to talk about are the income numbers, which would be like median household income as well as the Gini coefficient, an index of inequality. I'm a little bit more in the dark about exactly what those numbers will show. My guess is they might tick up a little bit in that we would see maybe some improvements in household income, but we will see on Tuesday. I think the bigger thing that I'm looking at on Tuesday is whether some of the gains that we've seen in reducing racial and ethnic gaps in income continue to decline. So both before the pandemic and then in 2022, we've had sort of tight labor markets, which tend to improve the incomes of a wider array of Americans than in less tight labor markets. And so Black and Latino incomes, for example, relative to white incomes in 2022 were sort of at or near their historic highs. And 2023 may show ideally or hopefully continued progress on that front, despite the fact that there are really significant and large gaps that remain. So this progress is always sort of modest relative to the progress that we would hope and want to see. So yeah, I will stop there, but happy to take any questions.
Great. We will start with the first question. What will it take to get the official poverty measure to be more comprehensive, as it is still cited by policymakers and lawmakers?
It's a great question. I mean, like the only reason, as far as I'm aware, that we still keep producing the official poverty measure is it's sort of mandated by law to be created. I think there's not many people, who are real big fans of the measure. It's an OMB directive to create it. There was a National Academy of Sciences panel that released a report in 2023 that was making arguments to further modernize the supplemental poverty measure. And one of the recommendations of that report was actually to change the name of the measure and call it the principal poverty measure, sort of recognizing that that is the poverty measure that really should be elevated at this point. Whether that'll happen, I do not know, but I think it's more of a question of, rather than modernizing the official poverty measure, sort of taking the improvements of the supplemental measure, continuing to improve that and really elevating that as the key measure of poverty that we track going forward.
Okay, I'm just going to tick through a couple more. My impression was that the poverty rate fell dramatically through the 1960s and 70s during the war on poverty, expansion of Medicare, Medicaid, et cetera, and has fluctuated. Whoops, where did it go? I'm sorry.
I see the question. Yeah, since then, basically, right?
Yeah. So
yeah.
It's fluctuated since then. So can you respond to that?
It definitely fluctuates. I mean, our earliest year that we track with our historical supplemental poverty measure is 1967. There, the poverty rate for the population was above 20%, and the numbers, the 2022 numbers were, I think, 12.4%. So there's definitely periods where that poverty rate was coming down more than others, and of course you see in recessions, especially the recessions in the 80s and early 90s, the SPM poverty rate like going up as opposed to down. But the long-term arc and the long-term trajectory has been down, and that's not just from the 1960s and early 1970s. You see sustained declines in the 90s and also in the 2010s, such that the poverty rate, I think, is down somewhere in the neighborhood of like 35 to 40%. From 1967 to 2022, and like I said, I don't expect the 23 number to be wildly different, even if it ticks up a little bit.
Okay, we're just going to tick through a couple more. Spoiler alert: the question about the USDA food insecurity data will be handled later on in the webinar. Is there current legislation that would change the way the poverty threshold is measured?
I have seen some bills that individual Congress people have put forward. I don't think anything that was close to passing, but I mean there have been efforts, for example, to take some of the recommendations made by that National Academy of Sciences panel, for example, to further modernize the poverty threshold. So one of the other recommendations, aside from changing the name, have been to try to build in more formalized methods for incorporating medical care and the need for health insurance in the poverty line or poverty threshold, as well as the need for childcare among families with children, which is sort of a more universal need in today's economy. And so I've seen some bills that have tried to like formalize some of those measurement recommendations into potential changes to the poverty threshold. Again, not in any bills that I've seen gain a ton of traction, but there's also the idea of the supplemental poverty measure historically is a research measure, and not something that we use to derive eligibility for public programs. But I've also seen there's been some interest from some lawmakers in trying to use maybe some of the more modernized poverty lines under the supplemental measure to update our system for allowing eligibility for benefits.
So is there any chance we can get a measure that tracks disadvantage, living conditions, access to transportation, etc., instead of just income?
Yeah, I mean, I'm a measurement person, so I always think like more measures are better than fewer to really get the poverty rate, the fact that it's come down is not incongruent with the fact there might be people at the very bottom of the income distribution for whom things are getting worse. And as I think, Deb's going to talk about the food insecurity numbers just came out. That's another measure of well-being, how people are doing. We had a conversation this morning about like maybe we could, with the, I don't want to get too in the weeds, with the redesign of the SIP data, the Survey of Income and Program Participation data, which has other hardships beyond food insecurity. Those are now tracked annually in that measure. It's a reduced set of measures, but elevating some of those measures, could provide value so that we're not relying only on income data.
So I'm going to give you one more question, but then we're going to continue with these questions in the round robin later. This is from another data guy. It seems like the key problem with the official poverty measure being the official measure is that this is used to determine program eligibility. Would it be feasible to shift programs to use the supplemental poverty measure or other measure to determine eligibility? How would that work when it incorporates programs participation?
Yeah, no, it's an important question. I mean, some people say it's just not possible because the measure does incorporate, things like SNAP benefit, like, so you would become not poor if SNAP lifted you above the poverty line, but that's the poverty line that that would get used to then judge eligibility for SNAP. I think it's actually not as complicated as that, and one could, in theory, use an SPM-like measure to or poverty thresholds. The poverty thresholds are more complicated under the SPM for sure. They vary by metro areas across the country. They vary by housing status. They vary in different ways by the number of adults and children. But like the poverty guidelines simplify the poverty thresholds, you could imagine a world in which the government reduced the complexity in the SPM poverty thresholds in order to modernize a line that's more appropriate for determining eligibility. At the same time, like another way to continue using the official poverty guidelines and thresholds is to potentially just update the multipliers of that threshold to recognize that those poverty lines and those eligibility thresholds are too low. So I'm not sure that, even though I think it's potentially feasible to move toward a world where the SPM thresholds are used more programmatically, it may not also be like the simplest or best way to do that.
Thanks. We'll get to some more of your questions in a bit, but I want to turn it over to Stan Dorn, who is the director of the Health Policy Project at Unidos US, advocating for health justice for Latinos in America. Stan's previous work was at Families USA, the Urban Institute's Health Policy Center, the Economic and Social Research Institute, the National Health Law Program, and the Children's Defense Fund, where it was possible he could have shared a wall with our own Deb Weinstein. Suffice it to say, Stan has been working on health policy issues affecting people with low incomes his entire adult life and probably down into his teens. Fun fact, when Stan's not tackling our nation's health issues, he is perfecting his talents as a serious jazz pianist. And Stan, is there any other kind?
Yeah. Unserious jazz pianist.
No.
Which thank you so much, Ellen, and thank you so much, Debbie, for having me on this conversation today. It's really an honor to be with you and to be with you too, Chris. I'm going to try to share my screen. Here we go. Let's see if this works. Is that working? Are you seeing a slide deck? All right, excellent. So we'll talk about expectations for health insurance numbers in 2023, what we think we may see next week, and some ways to think about it. I'm going to talk about three things. You're always supposed to talk about three things. Before I was focused on healthcare, I took classes in public speaking in junior high school. They said always talk about three things. I think that rule has its roots in Christian theology, but even as a nice Jewish guy, I'm still going to follow it. We'll talk about what we're likely to see next week, what are some technical issues to think about, and what are some other things that were going on with healthcare. So next week, I think what we're likely to see is that the percentage of people without health insurance will decline in 2023 compared to 2022, which was a further decline compared to 2021. One way to put that simply is that the number of Americans with health insurance will be at its highest recorded level in American history, representing continued progress from the last several years. And what makes that particularly extraordinary is that these gains will take place despite remarkable headwinds. Starting in April of last year, continuing through December, Medicaid experienced its greatest losses in coverage in American history, falling by 9 million people from April through December. And even so, the Census Bureau numbers are likely to show that health coverage overall grew in 2023. And that is a powerful testimony to the impact of enhanced premium tax credits that help people buy their own insurance on the ACA marketplace, as well as a tribute to other important policies that were put in place by the Biden-Harris administration. But these numbers will highlight the importance of protecting those enhanced premium tax credits. If they expire, as they will do under current law, unless current law gets changed, the Urban Institute estimates that the number of uninsured will grow by 4 million. So the progress we've seen, that we're likely to see in 2023, as well as 2022, 2021, will disappear unless we can keep that level of protection in effect. So here's the Medicaid numbers. These are administrative totals coming from the agency itself. So that's generally viewed as more reliable than the Census Bureau survey-based estimates. And so these are averages for each year, and they show year after year after year, the number of people covered by Medicaid and the Children's Health Insurance Program, or CHIP, has gone up. And these are 12-month averages, very demure, very mindful, steady progress. We'll break it down a little bit more later and see some interesting things. But the number of people covered through the Affordable Care Act marketplace, buying their own insurance in the Affordable Care Act marketplace, has really skyrocketed in these last few years, driven by the rocket fuel of enhanced premium tax credits, which took effect soon after 2021. So as a result, it's understandable. Those are administrative numbers showing public programs are covering more people. No reason to think employer-based coverage is covering fewer people. So we're likely to see annual numbers of uninsured that go down for 2023. But there's some technical things to keep in mind. So one, it's long been the case that Census Bureau data undercount Medicaid participation. People are asked, do you have Medicaid? Or did you have Medicaid last year? Sometimes people had Medicaid and they don't know it. They might not remember they had coverage. They might say, oh, no, I didn't have Medicaid. I was enrolled in a Blue Cross Blue Shield plan. Well, that's how their state covered Medicaid. So people don't always understand their situation. Census Bureau data have always undercounted Medicaid. The reasons to think that undercount may be a little higher this year than in the past. But the big change this year is that the Census Bureau numbers all try to give you a single number for the whole year. Here's the number of uninsured in 2023. Here's the number of people in Medicaid in Texas in 2023. This past year, every month, or not every month, but month after month after month, there were major, major changes. And so there's a mismatch between the changing picture of people's real coverage in 2023 and the Census Bureau's mission of giving us one number for the entire year. Now, the way that plays out is different for the two surveys. So the current population survey, those are the numbers that are going to come out on the 10th of September. And then the American Community Survey numbers are going to come out on the 12th. The ACS numbers have a much bigger sample size. So the way the Census Bureau talks about it is those are the state numbers. CPS is the national numbers. In truth, the ACS numbers are better for both the nation and for the state, but whatever. This is how they talk about it. But the methods are really different. It's not just that the ACS has a much bigger sample size. CPS every March, so March 2024, CPS asked a bunch of people, hey, what was your health insurance last year? Did you have Medicaid? Did you have Medicare? At any point in the year, did you have Medicaid or Medicare? At any point in the year, did you have employer-based coverage? And only if the person answers no to everyone, no, I never had Medicaid, I never had Medicare, I never had employer-based coverage. Only if they say I didn't have anything at any point in the year are they counted as uninsured. ACS is really different. ACS, they don't just not just at one point in the year, throughout the year, sampled randomly at different points in the year. They say, do you have health insurance right now? If so, what kind? Is it Medicaid? Is it employer coverage, et cetera? And then they put together an average composite from the entire year. So that plays out really interestingly, as we'll see in terms of what else was going on in 2023. So pandemic protections for Medicaid had been in place starting in early 2020, where states got a bunch of extra money for their Medicaid programs. And in exchange, they were forbidden from throwing anybody off the Medicaid program. Even if their income went up, unless they left the state or died, they had to stay on Medicaid. So we saw the number of people covered. This is Medicaid and some forms of CHIP, the Children's Health Insurance Program. The number of people covered rose by about a third between early 2020 and April 2023. And I mentioned April 2023 because that is the date on which April 1st, 2023, Medicaid continuous coverage requirements ended. And starting on that month, states could begin to terminate people, redetermine their eligibility, and if they weren't found eligible, end their Medicaid. Now, states varied a lot in terms of how they did this. Some states started right away on April 1st and threw as many people off the program as they could. Others waited later. They worked really hard to preserve people's coverage. But overall, we saw some major reductions that took place. Now, earlier, we saw those demure and mindful annual averages for Medicaid, and it marched nicely up every single year. But if you break it down month by month, what happened in 2023 was a lot more stormy. The year started off with 93 million people enrolled in Medicaid. By April, 94 million were enrolled. And by December, the end of the year, only 85 million were enrolled. So that's a 9 million person drop over the course of 8 months. To put that in context, the biggest one-year drop in Medicaid coverage recorded in past Census Bureau data was a 2.5 million person drop, which took place in 1997. So the losses that we experienced through Medicaid unwinding were more than 3 times the drop in Medicaid coverage over an 8-month period was more than 3 times the size of the largest previous 12-month drop experienced in American history. And despite that, the Census Bureau numbers are going to show that the number of uninsured came down, which again testifies to the extraordinary power of the positive innovations that were put in place by the Biden-Harris administration and its congressional allies. Now, just for your information, the unwinding continued throughout 2024. Another 4 million people lost Medicaid. These are net numbers of people covered by Medicaid, so it's really been a serious problem. Now, not everybody who loses Medicaid becomes uninsured. So about 30% of the people terminated from Medicaid moved immediately into other coverage, but the rest experienced some time without coverage. some very brief period, less than a month, but almost half of the folks who lost Medicaid experienced 3 months or longer without health insurance. And it was a serious problem. Other survey data shows that almost half of people, or maybe more than half, who lost coverage and tried to get back onto Medicaid, were not able to get essential services during that period of time because of cost. Overall, about a fourth became uninsured. Almost half returned to Medicaid. Probably shouldn't have been eliminated in the first place. More on that in just a moment. But think about what this means for the CPS numbers. CPS they'll say, well, did you have Medicaid at any point during the year? Well, yeah. People who had Medicaid in January through April will say, yes, I did, and they will be counted as insured. So CPS is not going to pick up the problems that happen because of Medicaid cuts. ACS will pick it up to some degree. It will pick up the average throughout the year. So the Census Bureau data will vary in the extent to which they're going to pick up these changes. Now, to just give you a sense of the magnitude of loss, we did working with some of our civil rights allies, very conservative estimates, assuming that Medicaid beneficiaries of every race and ethnicity are equally likely to lose Medicaid. And we know, of course, that's understating the degree of inequity that results. But even under that very conservative set of assumptions, the number of Latinos covered through Medicaid fell by 4 million. The largest past loss the community has ever seen was a 1 million person loss, a 1-year period in 2019. African Americans, the number covered by Medicaid has fallen by more than 2.5 million. The largest previous loss was a 700,000 person drop. So these have been the biggest losses in history for communities of color, also for non-Hispanic white people. But it's not a single picture uniform across the country. States varied enormously. So in 4 states, the number of children covered by Medicaid fell by 25%, while in 5 other states, the number of children covered by Medicaid fell by 2% or less. So depending on which state in which a child happened to live, their odds of keeping their insurance or losing insurance varied by more than a 10-to-1 ratio. One way of thinking about this is that we know the number of children covered by Medicaid fell by more than 5 million during unwinding. If all states had done as well as the median state among the 10 best, then instead of 5 million children losing Medicaid, 800,000 children, the number of children covered by Medicaid would have fallen by 800,000. That's tragic, enormous, but another 4 million children would be walking around today with Medicaid. They would have gotten their well child screenings. They would have gotten glasses to see the blackboard in school, their asthma medication filled. If, God forbid, some of them were hit by a car when they were riding their bike, their families wouldn't have been wiped out by the resulting medical bills. So the difference made by state policy choices has been profound. And the way this has played out has not been people actually becoming ineligible. It's mainly been about paperwork. So more than 2/3 of the people terminated from Medicaid were never found ineligible by their state. The state just said, we didn't get the information back from the families that we needed to determine their eligibility. Why didn't they? Well, for almost 60% of the people who tried to renew their Medicaid, they encountered serious procedural problems. They couldn't get through to the call center on the phone. They didn't know what documents to present. They presented their documents and the state said they never received it. So it's understandable why almost half the people who lost Medicaid went back onto the damn program after they're terminated. They were eligible the whole time. And many others who didn't make their way back, in fact, were eligible and became uninsured because of states' decisions about how to run their Medicaid program. So there are important policy lessons going forward for Medicaid and health programs. It's critical that we reform these programs to make paperwork a much smaller issue, and to make sure that states have incentives, strong incentives, to keep all eligible people enrolled. And there are things that we've learned not to do. It's critical that we not impose more paperwork on people and say, what, unless you fill out all these documents documenting your work effort, we're going to terminate your Medicaid. We know that people who are actually working lose their Medicaid when that happens because of missing paperwork. And it's critical that we not say, hey, states, we're going to give you even more authority to find people ineligible, because we know lots of eligible low-income people who need healthcare will be thrown off the program. And that is a key feature of what some people are proposing in terms of Medicaid per capita caps and block grants. But all of that is a conversation for the future. For next week, the conversation is more about, we've seen remarkable continued progress, both in 2023 and the last several years, bringing down the number of uninsured. It is extraordinary that this progress occurred despite huge losses in Medicaid that took place in 2023. And that in part testifies to the importance of these enhanced tax credits under the Inflation Reduction Act, which will go away after 2025 unless Congress acts. And if Congress doesn't act, then the good news we've seen over these past few years will turn into terrible news for millions of Americans. So those are some of my thoughts. Glad to answer questions as best I can.
Great, thanks so much. There are quite a few questions that have been coming in, and let's start with this one. Is there a definitive report, a one-page summary, showing which strategies and tactics have effectively addressed the root causes of food insecurity? In other words, what's been working? Oh, I just realized that this is a question about the food insecurity part, so we're gonna hold that one for later. Here's another one. Is this adjusted for the over allowance of those who qualified during the pandemic?
No, these numbers just show changes over time. And in fact, during the public health emergency, as I mentioned, Medicaid was not allowed to terminate people. And so as a result, you didn't have the churn like often with men. We're seeing it happen again, where people are sent a notice. They don't get the notice. They can't figure out what it means. They're terminated. They come back on the program. All that was stopped for several years. And that's one of the big reasons why we had the number of uninsured fall to the lowest percentage in American history.
Here's a fan. Great as always, Dan. Despite coverage being expected to rise overall, do you expect that we'll see an increase in the uninsured rate for kids?
Not in the CPS numbers, because the CPS numbers, remember, that's like, hey, it's March 2024. Did you have health insurance at any point last year? Well, children who lost their coverage after April had it January through April. So I don't think we'll see it. We might see it in ACS. So what I would look for in the ACS numbers are going to be the state numbers. So I would look and see, for those of you who do work at the state level, check and see what happens in your state to the number of insured children, to the number of insured people overall. And you may have reason to say, hey, even though America as a whole did better, here in Texas or here in Florida, it didn't work out so well for kids. So I would look at the ACS numbers for children, and we may see some differences among states. We may see some losses. I'd be surprised if the ACS numbers show overall national increases in uninsurance among children, just because it's an average for the entire year. Medicaid continued to go up. Medicaid and CHIP continued to go up on average throughout the year, but who knows? And the Census Bureau, when they release these numbers, they characterize it as CPS is for the nation, ACS is for individual states. So I think we'll see a good news story for kids in both of those surveys, probably.
Thanks. How are you capturing the unhoused people with disabilities or older adults with communication issues?
Census Bureau asks questions for all those populations, and I don't know how they address those challenges. So I'm going to have to say I don't know, but I know that they do try to capture everybody who's not institutionalized. I don't think that these surveys. I mean, Chris, you probably know way more about this than I do.
Yeah, the ACS and the CPS are both household-based surveys. So the people who are experiencing people who are unhoused or in shelter, like there are some efforts to do some of the surveys in what they call group quarters, which include some shelters, et cetera. But usually the statistics that are published are not, at least for poverty, I'm not sure about health insurance, like are not incorporating those populations. And then we know they're missing a lot of populations who are not housed more generally. So it's a weakness and a limitation of the census data for sure.
So Stan, this is like the lightning round. I've got a couple of questions popping up here. Is there any evidence showing a correlation between states incurring budget deficits and the corresponding drop in Medicaid enrollment?
Not at all. Some of the states that did the worst in terms of preserving people's coverage had huge budget surpluses, and they just chose not to spend them on. I mean, what we have seen is a correlation between state spending on Medicaid administrative functions related to eligibility and the percentage reductions in Medicaid. So in federal fiscal year 2022, when states knew the unwinding was happening and most states were experiencing historic surpluses, some states didn't invest much in their Medicaid eligibility system. And guess what? Those were the states where the biggest losses were seen. So it's not a question of fiscal capacity. It's a question of values and priorities.
Okay, is there any data available about more children going into CHIP because the parents could no longer afford the family health insurance plans?
Yeah, the Georgetown Center for Children and Families, Georgetown University Center for Children and Families has done a lot of work on this. And what they found was that the CHIP program, Children's Health Insurance Program, enrollment went up some, but by an order of magnitude less than children's losses for Medicaid. So the way it should have worked was that children who lost Medicaid should have gone into CHIP by and large, or maybe the marketplace, but it didn't happen as much as it should have. And there's a really serious problem in some states like Florida that have a different bureaucracy that runs the CHIP program. And it's just pathetic, honestly, where the Medicaid program says, oh, you're ineligible because your income is at X rather than Y. X is enough to qualify for you for CHIP, but we're not going to give you CHIP. We're going to pass your files to the CHIP agency. And then people have to send the same information again and they have to fill out a form. And guess what? When you put administrative burdens on people, they fall through the cracks, don't get coverage. It's just a terrible situation.
How are states using Medicaid to pay for social determinants of health?
It's a great question. There's been a whole major national initiative sponsored by the Biden-Harris administration to increase state Medicaid programs' ability to take Medicaid dollars and use it to pay for supported housing or to pay for prescriptions for food. So that's an exciting initiative that's happened in the last couple of years.
And here's a question for both you and Chris. How are undocumented people accounted for in all of this? I know that's probably hard to measure, but curious if the data takes all residents into consideration, undocumented and documented.
Yeah, it's a really important question. And the unfortunate answer is that so undocumented individuals will be in the survey, like will be in the household surveys answering the questions. They may be underrepresented or undercounted, but the survey itself doesn't actually try to get at people's immigration or legal status. And so there's never any census published statistics that attempt to show poverty rates, for example, or income statistics for the undocumented population in specific, or households that contain, a household member who's undocumented. To do that, like basically researchers have to go in and essentially infer legal status or documentation status based on what is known in the survey. And that is, I'm sure, like, error prone, like an error prone process. But that sort of falls to researchers to try to identify and adjust and make adjustments and create statistics for that population.
Yeah, we know from the Census Bureau data about citizens versus non-citizens. We know about what language is spoken in the home, how well do people speak English, how long have you been in the country, where were you born, were you a naturalized citizen or born in the, we know about all those kinds of things. We don't know, are you undocumented or do you have a work permit, do you have a green card, none of that. So what the KFF, the organization formerly known as the Kaiser Family Foundation, they have their own, exactly as Chris said, an imputation methodology where they can estimate immigration status and use that to say, here's what the insurance rates are for undocumented immigrants versus non-citizens who are lawfully present. KFF does it. Also, the Urban Institute, they have a microsimulation model where they impute immigration status. But the short answer to the question is undocumented immigrants are included in these totals and do influence the number of uninsured. And obviously, as no one would be surprised to hear, we know that undocumented immigrants are more likely than anybody else. All else, common, all other factors held common. Undocumented immigrants are particularly unlikely to have health insurance.
I know there's a lot of folks too who are interested in like the child tax credit and the EITC and on this call. This is actually a really important issue for those numbers because the estimates of the effects of the child tax credit and the EITC, et cetera, are accounted for through a Census Bureau tax model. It's not by asking people whether they got the child tax credit or they got their EITC. So the census, because they don't make an attempt to infer or impute legal status, when they assign a child tax credit or assign an EITC, they're basing that on the number of children, the incomes, et cetera. So they may be over assigning credits essentially to families who are excluded from those programs and policies. So then it takes, groups like the Urban Institute, et cetera, to be able to make those adjustments and make sure that we're not overstating the effects of policies like the child tax credit for certain groups like that.
Thank you. There's a lot more to cover, so I'm going to move on, but we will address some of the questions at the end. And Stan, thank you for referencing KFF. Someone did include a link in the Q&A to some KFF resources. And again, we will be sharing all resources and links and sites with everyone who's registered for the webinar. So good to note that. And our final cleanup hitter is our beloved Deb Weinstein. Deb joined CHN as our executive director in June of 2003 after years of serving on our board and supporting our program priorities, very much appropriate to today's webinar, on strategies to lift children and their families out of poverty during her tenure as the director of the Family Income Division of the Children's Defense Fund, and before that, her extraordinary work in the state of Massachusetts. And I tried to come up with a fun fact about Debbie, and all I could come up with is just about everything. And Deb, you're muted.
Sorry. Well, thank you very much for that, Ellen. Thank you to Stan and Chris for terrific presentations. There's a lot ahead here, and people asked a lot of questions, very good questions about what kinds of information can you get out of this or that survey. How can we improve upon them? None of them are perfect, but they offer opportunities for us to talk about what's happening to people. And so I'm going to talk about several different sources of information and build upon what you just heard with a little more specific about how you get at it next Tuesday and next Thursday. So let me actually turn this into a real, there we go. So, we've learned what helps. Let's use what we've learned. The first part of what I'm going to talk about is really these major issues that you've heard a little bit about. In the supplemental poverty measure that Chris was telling us about does show the benefits of benefits, in particular the child tax credit, earned income tax credit, and we saw in 2021, when the expanded version of the child tax credit was in place, child poverty declined greatly. And then in the data that we got last year, from 2021 to 22, moving from when we had the child tax credit to when we lost it, or the expansion of it, poverty rose dramatically, from 7.8% to more than 12%, and child poverty more than doubled, as this data shows. So, shocking that we saw what worked and then we let it get away from us, and children paid the price of that. People were asking in the question, how can we make this part of what's being discussed in the election. To some extent, it really is. And just today, there was a quote from Rosa DeLauro, a big champion in Congress for the child tax credit. And her quote here, I think this is a moment, and we are that close to seeing a permanent child tax credit. Both the Harris and Trump campaigns have supported some version of this, and our work together has to be to press for that. So this first part is giving you certain messaging tips, and then we'll move into kind of where you can find the data to support it. But the first big message, certainly talked about by Chris, bring back the expanded child tax credit. We're going to get data from that supplemental poverty measure coming out Tuesday, as well as the monthly data and another survey called the Household Pulse, which I'll tell you about after a bit. All of these make the case for reviving the child tax credit. So this is the data that we have to use. We know people are most effective when they're talking about their work in the states where they live. There's some data, but limited data, as Chris said, that has to do with states coming out on Tuesday. There'll be more data coming out on Thursday with state and local data. But we will be supplying you with the details so you can make the case. But certainly the expectation is, we saw child poverty go way down. We saw it shoot back up. The data coming out next week will most likely not monumentally change that. We're not going to fix it until we bring back the child tax credit. Stan told you about the another big part of our message: keep people insured. That means protecting and improving the Medicaid program, and it certainly involves making sure the Affordable Care Act's advanced premium tax credit sticks around. Later in the presentation, just by way of illustration of other kinds of programs that we need more affordable housing. That's being talked about in the campaigns. And there's data that you can use to show how states and localities, how many households are paying more than half their income on rent. We'll show you how you can get at that. We're going to give you lots of information. This is kind of a sample to show you. We have an action toolkit that we're going to send you in a follow-up email with templates that you can use to share the new data to your staff, to congressional staff. And so we're going to give you lots of information so you can insert all these critical issues in the election campaign. And these are some graphics. Leo Wynn on our staff, who's helping with this webinar, has some sample graphics that he's gotten from other organizations that we work with. We'll be supplying you with tools so that you can put this kind of information out in digital media as well. So again, here are lots and lots of resources that we're going to be sending you. You'll get the recording of this follow-up email with links to all kinds of resources. On September 10th, next Tuesday, we'll put out a little table that we call First Look that just will show you what a lot of the data is showing. After the 12th, when that American Community Survey data come out with lots of state and local information, we'll be sending you more analyses. So you'll be getting stuff before the data come out to prepare you, and after the data come out so you can use it. So what's here and what's coming? Heard mostly so far about the current population survey and the supplemental poverty measure. That's what's coming out on September 10th. And then the bigger American Community Survey coming out on the 12th. But there's some stuff that's already out. There is data that doesn't measure poverty, but measures various forms of hardship, including not having had enough to eat or having a hard time paying the bills. That's the Census Household Pulse Survey. And the most recent one that's out is, just through towards the end of July, very current. And the next one, I'm going to hand it over to Ellen, our moderator and great food expert, nutrition expert, because we did just get, here we go. Oops. Wait, what happened? Oh, sorry. I'm just giving, I think, so that I don't lie. I'm going ahead here so that you can see this new data that just came out yesterday from the Department of Agriculture, Food Security in the United States. And Ellen, tell us what we found from this.
Well, what we found is not, unfortunately, surprising. The USDA's Economic Research Service, ERS, released, as Deb said yesterday, the food security report for last year. And it revealed that 47.4 million people in this country lived in households experiencing food insecurity, an increase of 3.2 million compared to 2022. And 13.5 million compared to 2021. And, this spike is, as I said, not surprising when you factor in inflation and particularly food inflation, but more so the rollback of critical COVID-19 pandemic relief provisions, such as the boost to SNAP benefits, the universal free school meals to all school children, and as Deb mentioned, the expanded child tax credit. These supports all allowed families to experience lower food insecurity. What the stats tell us is that 1 in 7 households, 13.5% of people living in this country, struggled with hunger. 13.8 million children, and these stats will be shared with you in the materials and resources that will be sent out afterwards. The families with children was up 3.2%, and 34.7% of single parent households headed by women experience food insecurity. And also that rates of food insecurity are higher for Black, 23.3%, and Latinx, 21.9% of households, as opposed to white non-Latinx households were at a much smaller rate of 9.9%. Interesting, households in the southern region of the country continue to experience higher rates of food insecurity, and that has been consistent over time. And urban areas of 15.9%, and rural areas 15.4%. Very important, since SNAP is housed in the House and Senate Agriculture Committees. And suburban food insecurity was significantly lower at 11.7%. Why is all of this important right now at this particular point in time? The Farm Bill is being discussed, deliberated, negotiated right now. And there are proposals in the House and the Senate by some that would take $30 billion over 10 years out of the Thrifty Food Plan benefit adjustments, which is how allotments are determined. They would reduce that, which would just create greater food insecurity moving forward. So all of this is currently in play right now in the Congress. Deb will get to that later on in talking about what all this means for our programs, but it's something very much to hold up when we see how much those pandemic era programs kept people afloat.
Okay, well, thank you very much for that, Ellen. You can see I got steamed up yesterday. There was a quote from a conservative commentator from a Heritage Foundation publication that made its way into the New York Times yesterday. The threat of an empty stomach is a great motivator for people who are able to work to find work. But I threw in the December unemployment for these various years, very low unemployment, except for the biggest pandemic recession period. You know, people are working and their food insecurity was growing, especially once the other benefits that Ellen mentioned went away. So, okay, on to the new data. And I can see we are not going to have time to do everything that we hope to. This presentation is supposed to last until 2:15. We can go a little later if you have the patience for it, but let me make sure you know these include links, and when you get the follow-up email, you will get all the live links. On Tuesday, you'll get income in the United States, poverty in the United States, health insurance in the United States from that current population survey. There will be a press conference at 10 a.m. And this tells you how to get there. And once you can attend the press conference via YouTube or other means that are on their website. And once they have the press conference, all the data will be up on their website as it says here. You know, it is important to be reminded what the poverty threshold is. This is the estimated threshold for the data that they will be releasing next week. You can see it's pretty low, but that's what it is for these different, to some extent, age and family or household size. Then again, you're going to see, and I'm showing you here how to get there. Pretty simple, census.gov. There's a category of topic, select income and poverty, and then select poverty. What you see if you check it out ahead of time is, of course, the data they put out last year, which is for 2022, but on September 10th, you'll start to see the 2023 data. And as we've heard, the supplemental poverty measure findings will also be in the report that comes out on Tuesday. This gives you examples, the official poverty measure, the data that came out last year, and the supplemental poverty measure. This is instructive, just to show you for a second. Very little change from 21 to 22 using the official measure, because that doesn't count tax policies like the child tax credit. But when you count the child tax credit in the supplemental poverty measure, you do see this big increase in poverty, because from 21 to 22, the expanded child tax credit went away. And you can see how that plays out by race and, of course, for children. Whereas we said before, the child poverty rate zoomed up from 5.2% to 12.4%. The good things about the official poverty measure from a current population survey, it does have a lot of tables that let you get at issues of if you work, if you don't work, the education levels, race differences. It has all of that, and it is instructive. But because this sample isn't big enough, you really can't get very much by state or locality. For that, we really have to wait till Thursday. And then you've already heard of the advantages of the supplemental poverty measure, shows the anti-poverty effectiveness of various government programs. Here too, not really big enough sample to show detail by state, by race, for instance. These are just examples. When you go on the website, these are the kinds of tables that you can get into. And I'll skip right by that, but you'll have it. Again, I said supplemental poverty measure does have state data, but as Chris pointed out, it will average together 3 years in order for the sample size to be big enough to be more reliable state by state. This was from last year. You'll see a similar map on Tuesday, and it'll show where the supplemental poverty measure of poverty is higher than the official rate. Interesting that California was higher, where it's not statistically different like Colorado, but in most of the country, the supplemental poverty measure was lower than the official, again, because it takes into account the benefits that were lost. So again, from moving on to what you can find about health insurance, and Stan told us about this, you will find from in the new report, there will be a health insurance coverage status and type. This is last year's, so it shows 21 to 22. You'll see a similar table, 22 and 23. So we'll see. Last year, as we did see a reduction in the number of uninsured, as it shows the circle things at the bottom. Are we going to continue to see that? And Stan thinks we probably will, with the caveats that he mentioned. One issue that sort of paled in a way next to all the Medicaid unwinding, the losses of Medicaid that Stan talked about, but the tables or the report does tell us that there is a huge difference in the number of uninsured, whether it's a state that expanded its Medicaid program or didn't. And you can see the blue-green on the right. The non-expansion states have far higher levels of uninsured people. So you've heard a lot about the Affordable Care Act marketplace insurance, and Stan had a table graph rather just like this, so I'm going to zip right by it. But remember, we've got to work together to prevent the expiration of the great premium tax credit benefits. Income, Chris talked a little about that, and so I am really going to kind of slide right by this. Again, this is an illustration of the kind of tables that you'll see measuring median income. We're always interested in racial differences, and this gives you some of that. In particular, last year's data, or that is from showing through 2022, did show how certain government actions and economic forces did the unusual thing where Blacks and Hispanic households did not lose income because of the inflationary pressures. The biggest story, as you can see, is their incomes are far lower than Asians and whites. But they didn't lose ground last year. Will that keep up? We'll have to wait and see. Inequality actually declined in the data that came out last year. Again, as Chris suggested, we'll have to look to see what happens again. Now, moving on to the American Community Survey, that data is coming out on Thursday, the 12th. It's a much bigger survey, and so it will give you data for not just states, but congressional districts, places like cities. And so it can answer a lot of questions that the other surveys are just not big enough to answer. And we particularly want to focus on disparities by race and ethnicity, and you can get some of that data. And I am going to show you some of that in a second. In fact, okay, here's the High Wire Act. So I am going to stop sharing this. Wish me luck, everybody. I am going to, here we go. Share again. All right, can you see Census Bureau, explore census data? I hope
Yes.
so.
Yes.
So you are now looking at the Census Bureau website, and you can see at the top, the URL to get into it is data.census.gov. So that is where you go to get the American Community Survey data. You go to advanced search, and I hasten to say, we will have written instructions that will be in the follow-up email. So advanced search, what I'm going to do is get into one very huge table to show you how you can get at state, but you could select place, so you could get a city within a state, and look at a big table. I hope I'm going to do this right. S0201 is a big table that has lots of data. And I am going to pick a state for that. And I'm going to pick Arizona for no particular reason, except it's early in the alphabet. Well, I think I needed to do this S0201. Oops, sorry. So that's the selected population profile. Let's see if we get there. No, we still have to go back and get Arizona. But the critical thing here that I'm trying to illustrate here is how to get race and ethnicity data. Because I'm going to show you how to find poverty and child poverty by a whole lot of different racial choices. So I think we've got it here. So we've selected this selected population profile. Again, I'm going to give you written instructions for this. We've selected a state with any luck. And you can kind of click on filters. And it is showing Arizona as I asked for. And so now we clicked and we got the table. And you will see that this is a table that you can kind of scroll down and to the right forever. But I just want to show you this is a useful table for lots of information you may want to know about. You might want to know about various kinds of household types. You might want to know about school enrollment, educational attainment, disability status, nativity status, language spoken in the home. Then there's a bunch of stuff about employment. You're getting restive, aren't you? But as I keep scrolling, about employment, income, health insurance, and finally we get to poverty rates for families and individuals. And for our purposes, we think that people rather than families is useful because we have good data for children, the under 18 here. So, all right, so we finally got here. And we see that overall, 12.5% poverty rate in Arizona for all people. There are lots and lots of racial choices here. And I will say that the Census Bureau is in the midst of making changes in the way it asks questions about race and ethnicity. These reflect some changes that were made. So you probably can't compare back in time before. You shouldn't go back any further than 2021 for comparisons if you choose to, but you don't need to worry about that. What we recommend is that it's up to you, but Black or, well, taking each racial group, but using as an example, Black, you could use Black or African American alone, but we recommend Black or African American alone or in combination with other races. And if you feel that you want to do something different, you certainly can, but and we do that. You choose the racial groups you want to include, American Indian and Alaska Native alone or in combination. Same with Asian. And there are a zillion other subcategories. And most of you probably won't want to use all of them, but you might want to use some. So here I am scrolling along. And you have to scroll very far until you get to the white category that we recommend that you use. Before I get there, here's Hispanic or Latino of any race. That is the one to choose for Hispanic or Latino. And then coming white alone, not Hispanic or Latino, is the white racial group that we choose. So you can get all of this information for your state. I tried it earlier today, actually for San Antonio City, because someone was asking, and you can find a city using the same approach. Here it shows the under 18, so children. I am going to, so again, I will give you all of the written instructions so you can get here and do this. It's cumbersome. I wish there were a better, easier way of getting to the racial breakdowns, but this table allows you to get it all in one place. And I think you probably want to do that. So I'm stopping sharing that. And I am going to go back to sharing the rest of the presentation. Okay, so we're off our high wire act. This is another example of how you can use um, the census website to answer questions on other topics. And so again, you'll get all of this. It gives you the very precise instructions on how you can go to data.census.gov, advanced search, select the state. In this example, it's New Jersey. We give you the table number here, and chose to add up um, uh, information for people with incomes up to $50,000. And this shows the instructions, and you could look, as you can see where all these little arrows are, how many people are spending 50% or more of their income on rent for each of these income levels. And it shows how to do the arithmetic on it. And in New Jersey last year, or 22, more than half, 55.1% of households with incomes less than 50,000 in New Jersey spending half or more of their income on rent. You can do this for your community to make the case that we have to be doing something about affordable housing. There is more data. Here's the link to Chris's wonderful monthly poverty tracking. I mentioned the household pulse surveys, which show hardship in various different ways. There's the link to that. We don't really have time right now for me to explain about the use of the household pulse data, but if you go to this particular site, it does not give you every single aspect of the detail, but it will allow you to say how many adults in households were they reported that in the previous 7 days, there either was sometimes or often not enough to eat. A very powerful statement. So that is something that's very current data that you can use in combination with the other data. And this is just some data that we pulled from Household Pulse so that you can see it. And it does show from the period from 21 to 23, averaged together large increases in the people who reported that kind of hardship, that many people saying that they sometimes or often didn't have enough to eat. And that is very related to the loss of the child tax credit and the nutrition program. So all that data helps you craft a compelling message. We need you to be the messenger. Thank you very much. And please be assured we will be sending you all this information so you can make use of it and speak out, be part of the electoral campaigns lifting up these issues.
Thank you all for joining us today. Some of your questions that we didn't have time to get to will be addressed in the resources that we are sending out. Before we leave, there have been quite a few questions and comments about data collection and information on Indigenous people. Can any of you address this and how that is captured in any of this data?
Well, in part, if you Chris, I'll shut up. But if you saw that part of the census website that I was scrolling through, there are a lot of indigenous people categories that were in. When you select the all racial categories, that it does have the broader category of American Indian and Alaska Native, but if you keep scrolling, you can see specific tribal categories. So there's lots of detail, and you can select what you want. Now, the difficulty is in given areas, if there aren't very many people in those categories, the data may not be that reliable. The samples are just not large enough to be reliable. In a state like Arizona with a lot of tribal communities, you know, that's likely to be reliable. Sorry, Chris, go ahead.
No, I think you basically said what I was going to say. I mean, it's also a much worse problem in the current population survey, which has the income and poverty data that I was talking about, because the American Community Survey is a much larger data set that allows for the you know, state and sub-state variation, and that's partly because the sample's so much larger, and so the sample sizes for groups like American Indian, Alaska Natives samples is much larger there. Usually in the current population survey, when you're trying to get at some of the smaller groups, you usually also, like, kind of with the states pooling multiple years of data, and that again is hard when you have these years where things are changing so much year to year.
A couple of things to add. One is you can get poverty information from the American Community Survey. It's not necessarily released in a report in the same way the CPS is. It doesn't have alternative measures, but you can get information about the number of people with different demographic characteristics whose household income was below 100% of poverty, 120, whatever the percentages that you want. And one good place to go for that is IPUMS, IPUMS. It's a wonderful site that lets people like me who really can't go beyond high school algebra, nevertheless do all kinds of things in making tables online for all these. It's a phenomenal resource. The other thing in terms of indigenous folks is you have, if you really want to do a good job, it seems to me, you have to treat them differently than the way we usually do with different races and ethnicities. So typically it's, you know, non-Hispanic, it's Hispanics of all races, then non-Hispanic whites, non-Hispanic blacks, non-Hispanics, Asian American, Pacific Islanders, etc. Problem is with indigenous folks, there's often multiple identities. And that it will either become, so if you're both Hispanic, you identify as Hispanic and, you know, Cheyenne, you will not be in the non-Hispanic American Indian group, right? If you identify with 2 or 3 races, you'll be in the multiple races group. So if you want an estimate for indigenous people, what I would recommend considering is treating them uniquely and saying, let's have everybody who identifies as, the way the census puts it, you know, American Indian, Alaska Native, and even if they have other things too, Latino, multiple races, what have you, put them all into that classification. That's one way to get numbers that really address the reality of people's lives.
Yeah, that's really a good point, Stan. And in that big table that I showed people, which I hope was not too daunting, you can, by scrolling down, I was getting you to the place where you were seeing the poverty data. And scrolling to the right, you can find a category which would be, say, American Indian, Alaskan Native, alone or in combination. And that would seem to pick up the grouping that Stan was just talking about.
Great. Thank you. And again, we will be sending the recording, the slides, and just a ton of resources out to everybody. I want to thank our panelists, Stan, Chris, and of course, Deb, for sharing their expertise. And thank you all for joining. And I encourage you to continue to take advantage of all the incredible resources that CHN has to offer and make sure you're on all of our mailing lists. So have a great afternoon, and look forward to working with all of you on the policies to propel us all forward. Thanks.
Thanks, Ellen. You'll be hearing from us. And please ask questions, send emails. I have been known to answer them early and late because we really want you to use the information.